Most doctors miss this gallbladder finding, and that single mistake can completely change a patient's future. What you are seeing on the screen may look like a simple gallstone at first glance. But if you call it a stone, you have already made the first mistake. Inside the gallbladder lumen, there is a well-defined echogenic polypoid lesion arising from the gallbladder wall, which remains fixed in position and does not move even when the patient changes posture. The most important observation here is that this lesion does not produce any posterior acoustic shadow, and that one feature alone should immediately stop you from calling it a gallstone. Remember this clearly: gallstones move and they cast a shadow, but this lesion does neither. This is exactly where most people get it wrong. Now, when color Doppler is applied over the lesion, internal vascularity is clearly seen within it, and this single Doppler finding changes the entire diagnosis. On careful measurement, the lesion measures approximately 10 millimeters, and 10 millimeters is not just a number here. It is a decision. Here is the golden rule of gallbladder ultrasound that every radiologist must remember. A gallbladder polyp measuring 10 millimeters or more, especially when associated with internal vascularity, should always be considered suspicious. At this point, the diagnosis moves away from a harmless cholesterol polyp and raises concern for an adenomatous gallbladder polyp, which carries a real risk of malignant transformation. Because of this malignant potential, simple reassurance or routine follow-up imaging is not enough, and the correct next step in management is surgical consultation, most commonly leading to cholecystectomy. Lock this concept into your memory forever. If a gallbladder lesion moves and casts a shadow, it is a stone. If it is fixed and non-shadowing, it is a polyp. And if that polyp shows internal blood flow, surgery must be considered. Ultrasound is not just about creating images on a screen. It is about making the right decision at the right time. If you are serious about radiology, you need to know this.